Hi, good morning, everyone. It's Franco again, one of the nurses from the Orthopedic Institute at Macquarie University Hospital. I hope you guys are doing well today, and I hope you had a chance to check out the previous webinar about clinical governance. Today, we'll again talk about the national standards. We're done with the clinical governance, and this time we'll head on to the second one, the partnering with consumers. The partnering with consumers standards is another less popular standard among the eight. Um, in this standard, there will be some overlapping ideas and concepts related to the clinical governance, but still valuable, and it's good in the sense that it will saturate our understanding of what's with these standards as well as the clinical governance previously. Again, the overall objective of this session is to promote awareness and provide understanding of this national standard. First, we want to understand the concept and the role of this partnering with consumer standards in ensuring the quality and safety in healthcare. Also, we want to analyze the different components in this standard. We want to recognize and understand as well the different key tasks involved in each component or criteria. And lastly, we want to learn and understand the roles and responsibilities of each stakeholder when it comes to this partnering with consumer standard. Now, partnering with consumers standard. Now, what's in this second standard, the partnering with consumers? Now, according to the Commission, the Australian Commission on Safe and Quality Health in Healthcare, it says there the leaders of a health service organization develop, implement, and maintain systems to partner with consumers. So again, this is about the systems and processes in place, but this time directed towards partnering with consumers. First, who are our consumers? Obviously, the primary one would be our patients. But aside from the patient, we also include their families and also the carers involved in their care. So they are collectively regarded as the consumers. And when we say partnering or partnership, what exactly is that? This is when we involve them in the design, the planning, and the delivery of the care that they will receive. This is where we tend to include them in their own care to the extent that they desire. Like how much do they want to get involved? Like which parts of their care do they want to be involved? So we will include them, or we will get them involved. It relates to planning, design, delivery, measurement, and evaluation of care. Now, this part, we kind of get their partnership in a sense that when they give their feedback, their suggestions, their comment to us when they receive their care. So we use them to review, to improve our design of the care. What is the aim of this standard? Obviously, we wanted to promote partnership with consumers, and we do that because we want to achieve a mutually beneficial health outcomes or outcomes of care that we deliver. We want it to be best for them and best for us as well. So we partner with them. We take them as partners in planning, reviewing the design and the delivery, and the methods of the systems and the care that we have in place. So as we said earlier, we take their input, their feedback, and we analyze them, we review our system, and then revise it if necessary to make some improvement and to get the desirable outcome, best for them and best for us. Also, we want to involve them in their own care. So say while receiving care, we do the planning of care, nursing care plan, let's say, and then we collaborate with them. Like what kind of care would you like to have? What kind of strategies we will incorporate in your care? What suits you best? So we tend to partner with them. Like the clinical governance, this standard has its components or criteria as well. We've got 4 in here, and we will be talking about them one by one. One, we've got clinical governance and quality improvement systems to support partnering with consumers. Next is partnering with patients in their own care. Another is health literacy. And last one is partnering with consumers in organizational design and governance. The first component is the clinical governance and quality improvement systems to support partnering with consumers. In this component, it is divided into two parts. We've got clinical governance and we've got quality improvement systems. With clinical governance, again, it mainly talks about the overarching framework or structure that makes sure that there is partnering with consumers, that makes sure that health organizations are promoting partnership with consumers. In its first part, integrating clinical governance, this is where we set up and implement a governance structure. This is where we also develop policies and procedures that supports partnering with consumers. Aside from that, we also develop and implement a risk management system which will identify, monitor, and manage all the risks that can be associated with partnering with consumers. And lastly, we provide training on our workforce that will make them capable of promoting partnering with consumers. The second part of that component is applying quality improvement systems. When we say quality improvement systems, these pertain to those initiatives and processes in place that will make sure that the strategies and the systems we have achieves the best outcome or is performing effectively. Now, this can involve reviewing, measuring, and assessing the effectiveness and performance of organizational and clinical strategies. This could also involve the quality improvement strategy for partnering with consumers based on the outcome. So we look at the outcomes of care that we have, and we look at the strategies that we perform, and then we review them and analyze, see if we can do something better, or is that the best outcome that we could have. Now, also, we provide information on the outcomes of quality improvement activities. Say we've gained good reviews from our patients, we provide, say, an infographic interpretation of that, and we tend to communicate that with the governing body. And say if it's not so desirable, then the governing body can review that and communicate with other stakeholder and redesign the strategy. We can also communicate that by, say, posting that infographic on the communication board or sending out emails or make an advertisement, something like that. The second component is the partnering with patients in their own care. Like what we've discussed earlier, when we say partnering, this is where we get these patients involved in their own care. We want them to be partners in their own care to the extent that they choose, no matter how far they want to go, like to what extent or to which parts of their care they want to be involved. In this component, we want to make sure that there are systems in place and we implement those systems and we maintain those systems that supports partnering with consumers. In this component, sample of key tasks that can be involved are the organizational development and promotion of person or patient-centered care. Now, this is pretty much popular in every healthcare organization. We always have this patient-centered care. Another is the education and training of the workforce, making sure that they have the skills and they are capable of establishing and promoting partnership with consumers. Also, we want to make sure that we've got tools and resources that will support communication and shared decision making or the partnership. Say we've got templates for nursing care plans, we've got these strategies and methods of care where we involve the consumers. Also, we've got integrated care models and meaningful methods of measuring success or the outcomes of care. So we've got the evaluation or appraisal system in place. And those outcomes, we value them because that will give us information on how we can further improve or maintain our strategies or systems in place. The third component is health literacy. Now, this refers to how people understand information about healthcare or how they perceive health. And this understanding and this information, they apply this to their lives, which kind of influence their health practices and their decision making when it comes to health. The health literacy component has got two parts. One is individual health literacy, and the other one is health literacy environment. In individual health literacy, this pertains to these intrinsic attributes of a person: the skills, knowledge, motivation, capacity to understand and process health information and apply it to their lives. Now, this individual health literacy may be influenced by different factors. It can be influenced by age, education, disability, culture, and language. Health literacy is very important. It is not only applicable to patients or consumers, but also applies to everyone. For consumers, it is important because it sort of influences their decision-making capacity. It influences their health practices. With clinicians, it affects the way we manage the care of our patient. Like the care we're giving to a normal patient or a regular patient will be different from the care that we will be giving for a patient with diabetes, a patient with hypertension, a patient with limited mobility, a patient with eating disorder. We tend to have this health literacy that we're able to use them to modify and fit the health management that we'll be giving to this patient. For managers and policymakers, health literacy is very important because it influences the way they set up the system, the way they develop systems. So the complexity of these systems that they are developing will also affect the way consumers will be able to partner with us, to access, to collaborate with us when it comes to healthcare. The other part is health literacy environment, and at this time it pertains to the extrinsic attributes. It pertains to the infrastructure, the policies, processes, materials that are available in place that somehow promote health literacy or somehow help people gain access and understand health-related information and services. There are things we can do to promote health literacy environment. We could develop policies and processes that will reduce the health literacy demands. We could provide training for our clinicians, which will make them capable of, say, giving health education to patients and improving their interpersonal communications with patients. We could also provide educations for consumers. So say an event or healthcare event that they can attend to and they can learn something. We can also reduce the complexity of the systems so where customers or the patients can easily access health services. The last component is the partnering with consumers in organizational design and governance. As we've discussed earlier, this is where we take information from our patients. We value their input, their feedback, their complaints, their suggestions. We also take to account their attributes, their data, their characteristics, the diversity of the patients that we're having. And then we process this information to redesign or improve our systems in place. The key tasks involved in this component could include identifying the diversity of consumers who uses the services, say in our local community. Like what I've said, all the data that we can get from our patients, may it be their input, their feedback, their complaints, their characteristics, we can use them to redesign or to improve the design of our strategy or our framework in place, especially for this partnership with consumers. We want to establish and implement a framework that will maintain promoting this partnering with consumers in our healthcare organizations. We also want to develop and implement a policy to ensure that consumers involved in this partnership represent the diversity of consumers who use the organization's services. Now let's go to the roles and responsibilities of each stakeholder when it comes to this standard. First, the patients and consumers. Now we want them to be actively participating in their care, collaborating with clinicians, and assertively providing feedback, comments, and suggestions. Like what I've said earlier, their inputs give us good information to know what exactly they need, what suits them the most. And we can tailor our systems, our strategies to their needs so that we can achieve the best outcome, best for them and best for us. For clinicians, we wanted to make sure that we have the competency in carrying out the systems and policies in place for partnering with our consumers. We also wanted to make sure that we do them properly and we do them effectively. For managers, we wanted to make sure that the systems in place, the policies, the processes in place are being run effectively. We wanted to make sure that design is good and suits the patients most. We wanted to report information and feedback to our governing body and contribute to the redesigning of our strategies and framework if necessary. For the governing body, the role is quite similar with that of the managers, like what I've said from the clinical governance. But this time, they will be making sure that the overarching system, the governance system supportive of that partnership with consumers is being maintained well and being run effectively. And if not so, they will be the one reviewing and analyzing the system again and redesigning it to improve it and maintain its effectiveness. To recap what we have discussed today, the main aim of the Partnering with Consumers standard is to deliver health services that are mutually beneficial to both the consumers and the organization. The Partnering with Consumers standards has 4 components: clinical governance and quality improvement systems, which we say has 2 parts: the clinical governance and the quality improvement system. Another one is the partnering with patients in their own care, health literacy, and partnering with consumers in organizational design and governance. In the first component of this standard, the clinical governance pertains to the setting up of a main framework or a strategic structure that supports partnering with consumers. The quality improvement system part pertains to the systems in place that tends to monitor, review, and maintain the effectiveness of all the systems and processes set in place. Partnering with patients in their own care outlines the policies, procedures, and key tasks that promote patient-centered care. Health literacy refers to how people understand information about health and healthcare, and how they apply these informations to their lives. And remember, with health literacy, it's got 2 parts as well. The intrinsic attributes, which is the individual health literacy, which is pertaining to the internal capacity of a person to understand health and healthcare, which influences their healthcare practices. The other one is the external or the extrinsic attributes, which is the health literacy environment. And this pertains to everything that surrounds a person, like the structure, the policies and procedures in place, the interventions and systems around the organizations itself that kind of promote health literacy. Partnering with consumers in organizational design and governance stems from consumers' diverse attributes as well as their feedback to healthcare services. As we remember, we take as much data that we can take from our consumers. We use this data to help us determine the type of healthcare or systems or strategies that we can set in place to achieve the best outcome for our healthcare services. Each stakeholder has roles and responsibilities critical in supporting partnership with consumers. If you remember, first, the consumers, we want them to be actively participating in their own health care. We want them to be assertive in giving feedback, suggestions, comments, or even complaints. With clinicians, we want them to maintain their competency or capacity to carry out the systems and procedures set in place that are supportive for partnering with consumers. With managers, we want them to maintain all these systems and processes set in place, such as the policies and procedures, the risk management systems, the education and training. With the governing body, We want them to look after the main framework, the governance structure. We want them to make sure that it is performing well, it is being run effectively. And if not, we want them to review and help with redesigning this governing structure system. So there you have it. Thanks again for listening. If you have any questions, feel free to reach out. You can either ask me in person or send me an email. Thank you and have a good one.